Hello and welcome. My name is Dr. Jack and thanks for joining me on this video. I'm a board certified anesthesia pain doctor that has been in practice for about 15 years in the field of chronic pain. Throughout these years, I have noticed specific risk factors that put someone at higher risk of chronic pain. My goal in all my videos is to share knowledge with you so that your lifespan and health span are improved upon. I have no other vested interest other than the joy of knowing that each video I make will hopefully have a profound effect on someone's health and well-being. Know that this video is by no means going to discuss all risk factors for chronic pain, but only the ones that seem most common. We will be mainly covering 3 characteristics that puts one at high risk of chronic pain. The first are folks with the mindset that they can do whatever they want, no matter their age. Then we will cover people whose career puts them at risk, and end with folks that have a significant amount of pressure on their lower joints and spine. We will also talk about why each of these is hard to change. Please realize that this is not a video focused on what a doctor can do for you, but more of what you can do for yourself. It's about responsibility, accountability, and empowering you with the knowledge to minimize your risks of a life of significant chronic pain. So I hope you will stick around for the entirety of this video, as it can have profound implications in your future health and wellness. And with all of that out of the way, let's jump right into it. As with all things in life, it all begins with one's mindset, which sets us up for certain expectations. And in these expectations, we must ask ourselves, how realistic and sustainable are they as we get older? A huge portion of chronic pain patients are people that refuse to accept that our bodies physically age, and at some point it begins to put limitations on what we should be doing, how often or how long we should be doing them, and to what degree. And to be honest, it is typically men, and when I suspect this is occurring, I normally ask them to bring in their spouse, and it is quickly confirmed that they are doing things that can lead to injury that their significant other is telling them not to do. And yes, I have been accused of sounding like people's spouses quite often. You see, as we get older, our cells do not regenerate as well as they once did. This includes your muscles, your tendons, your ligaments, and joints. It typically begins in our late 30s to early 50s, depending on one's nutritional and daily exercise routine up to that point. If we are out of shape, sitting indoors all winter, eating poorly, gaining weight, and when spring arrives, we expect to be able to hop off the couch and go outside and do a bunch of yard work for hours without putting ourselves at high risk of injury. Well, I think it's important to ask ourselves in this situation, how realistic are the expectations? What I'm noticing is that we have a cultural issue where people are unwilling to accept the limitations of our physical bodies and turning to doctors for a cure that medicine simply does not have at the moment. When this unwillingness to accept things occurs, we then turn to doctors seeking answers and oftentimes wanting pills to extend this limit that is unnatural. At some point, we have to accept that there are some things that we just cannot do like we once did. Many people are very resistant to this idea, and it does not play out well for them, as it is only a matter of time before they get hurt. And even if their pain gets better, it does not stay better long term due to re-injury. Now, please know that I am not saying that you cannot go and do some yard work, or that you cannot go and play golf or pickleball or whatever activity. And I'm not saying that you can't do it at all. I am simply saying that perhaps you cannot do it to the extent that you think you once could. And if you want to do that activity more often, then you must start focusing on educating yourself on how to fuel your body with clean energy sources, meaning nutrition, with a focus on an anti-inflammatory diet, and start both cardiovascular and strength training. There are actually very well done studies that have shown the importance of strength training as we age, and how it can even affect our health span and lifespan to a greater degree than cardiovascular exercise. The next group of people that are at increased risk of getting chronic pain are those that are put at risk because of their job or occupation. I mainly talk about folks who work in places like construction, as a plumber, electrician, roofer, carpenter, or basically any job that is very physical that involves awkward bending or overhead work with some heavy lifting. However, please know that even if someone works at a desk job, you are still at risk of things like chronic back and neck issues due to poor ergonomics or poor posture. I have the utmost respect for these individuals because they are participating in our economy and they simply want to contribute to society by working and supporting their family. However, they are finding it more and more difficult to do every single day. These individuals need to change their job, which is easy enough, right? Well, absolutely not, and I get it. After dedicating one's life to a particular craft, it's not easy to suddenly change jobs and still earn the income that they once did. My advice is to do what one can to minimize the amount of the daily physical stuff and leave it to the younger coworkers to do the more heavy lifting and to begin looking at transitioning more into a management role or starting your own company within your respective trade or craft. Try and evolve with your current job. If you're someone in these more physical jobs, please know that there is a timeline to being able to continue to be as effective as you are at work. There's a reason why we age out of certain professions. The easiest, more extreme way of looking at this are professional athletes. There's a reason why the average retirement age of someone in the NFL is 27 years old. Sure, few jobs are that physical, but it's the wear and tear that one puts their body through over a period of time that ends up catching up to us ultimately. And the final group of folks that I see with increasing frequency are patients that have a BMI over 40. These patients can be classified as the 40-40 crowd because their age is around 40 and their BMI is over 40, or their body mass index, which is a way to measure our height to weight ratio. It's not a perfect measurement, but it is good enough for many purposes. Now, I want to pause here and say that if anyone is sensitive to hearing about weight issues, and I highly suggest stopping this video here. My goal is not to make anyone feel ashamed of their current body condition, but to educate and empower. I am simply trying to help, and if anyone is not emotionally in place to hear it yet, then I hope that that individual will get there one day and are taking the necessary steps get to such a place, because it begins with each of us. So with that out of the way, let's move on. Know that it is estimated that for every pound over ideal body weight, you multiply by up to 4 to 6 pounds of pressure to the lower body joints and spine that should not be there. So, say you are 5 foot 7 inches tall, and depending on your age, your ideal body weight is about 150 to 160 pounds. And now let's say you weigh 250 pounds. That's roughly 100 pounds over ideal body weight multiplied by 4 to 6, giving us 400 to 600 pounds of pressure that should not be there on your lower back, your hips, your knees, and ankles. It is there with every step, every time you sit, every time you stand, bend over. That extra pressure is accelerating the wear and tear of your joints and spine. Now, when we are young and our cells still regenerate rather well with less muscle atrophy and we are more active, we get away with carrying the extra weight. However, as we age, the decades of excessive pressure on all of these areas add up and it catches up to us. It is simply the laws of physics, and try as much as one wants, but no one will beat the laws of physics. Think of your body like a pickup truck. You would never expect the truck to hold up well if you drove around in it for decades with the back of it loaded with a bunch of bricks all the time. If you do not expect that truck to be in great shape, then how can we expect any different of our body's own parts? I have found the 40-40 crowd to be the most challenging to treat for many reasons. The first is that there is no fix that works fast enough for most people to continue with the amount of discipline required to begin to truly see the positive health changes. It is a slow process and one that takes a lot of initiative on the individual. Therefore, the best thing is prevention. Try and maintain as close to an ideal body weight as possible, eat well with real foods, and exercise regularly. In today's mass marketing world, you have to be able to educate yourself on nutrition. You will find that you have been told many lies, like breakfast is the most important meal of the day, or that eating 5 small meals a day leads to weight loss, or just follow the food pyramid. It blows my mind that patients are still being told these things, as they are simply not true. Now, this video is not about how to lose weight the right way, but I want to say that I suggest researching things like intermittent fasting, and if you're on a diabetic medication, talk to your doctor first, as well as consider increasing your muscle mass through gentle strength training, since muscle burns fat more than fat burns fat. And if you're using the latest GLP-1 injections, please know that long-term you need a backup plan. I discussed this before in my last video, so please feel free to check that out if you find it interesting. I suggest researching insulin resistance, and if you have low back pain or lower body joint pains, then focus all your energy on losing the weight before going out and doing a lot of walking or running, as it will only increase the pain in the area you're having issues with. Just because it worked for you when you were younger does not mean it will work for you now before you get injured further. It does not make sense for someone that has hundreds of pounds of pressure on their joints that has severe osteoarthritis to suddenly start believing that they can exercise their way to meaningful weight loss before they develop perhaps, say, something like a stress fracture. And one of my biggest suggestions to all of this is to try and listen to your body. Remember that pain is actually a good thing to an extent. It is our body's way of telling us that something is wrong or that we have reached a limit that is causing damage to our bodies. One of the worst things you can do is take a pain pill before an activity knowing that it is going to hurt because you are only fooling yourself and accelerating the problem. So there you have it, the most common risk factors for what I have seen, at least in the last 15 years in clinical practice, of what leads someone to putting them at higher risk of chronic pain. And so I hope you found this video helpful. As always, please feel free to share this video with someone that thinks they can benefit from such information. And consider giving this video a like for the social media algorithms. And so until next time, take care, stay safe, bye-bye, Pura Vida.